Last week, President Museveni announced new directives to avoid the spread of COVID-19. These include a ban on inter-district travel, unauthorized movement of public and private vehicles, while motorists were only limited to carrying cargo. The president also ordered the closure of all institutions of learning in the country, a move that has affected the health sector's ability to collect blood around the country. Consequently, several health facilities are suffering shortages.
Initially, we normally get 90 to 90, probably 90% of the blood from the student, that is from the school, and then 15 or 20 from the community.
Reports indicate that the Uganda Blood Transfusion Services sets a monthly target of 1,250 units of blood to be collected by each team around the country. Much as the Lango sub-region has been achieving the targets ever since its inception in December 2020, the figures have recently dropped.
The first COVID, the community were turning positive because in the first COVID there was not too much restriction being given. But now the challenge is coming on in this second COVID. And there's a lot of restriction, people need to stay at home, no much movement.
Right now, as we talk, we are having very few units of blood remaining at the blood bank at Lira Regional Referral Hospital. Bearing in mind that this is a region where we have very many malaria cases.
According to Edmond Acheka, the acting Lira district health officer, a lot of attention has been invested in fighting COVID-19 at the expense of looming blood shortage. He wants government to relax some of the measures to make it possible for health facilities to collect blood from the public.
This is the time when blood is most wanting. It is very important that even if we have lockdown, then we should also be having blood in the hospital to support our people who will be so much in need.
President said other activities should go on. Why not we also amidst the COVID-19 guide rules, we can also, because they say people can go for marriage, can go for wedding, 2020. Now, if I also go to a trading center, I get 20 people. We have 6 beds. Now the 6 beds, if the first lot comes 6, they disappear. The second one comes 6, they disappear. Up to the evening, we can't fail to come out with 30 units.
As a way of addressing the blood shortage situation, the district task force has resolved to intervene in the matter.
The need to collect this blood, it is for the purposes of saving lives. But if in the process of saving lives, we end up endangering lives, then that is another thing altogether. So for now, if they consulted widely, including with the National Task Force, and they are granted permission to do that, then perhaps it will work out.
Uganda has an estimated 80,000 to 90,000 registered blood donors, most of whom donate at least twice a year. However, with 90% of them being learners in the various education institutions, continuing restrictions here could have more repercussions for future medical operations in Lira. Nelson Omoya, NTV, Lira.